Okay, first I want to say thank you to Brightbot for having me and for presenting this webinar on lupus. And I'm not a doctor, so if you have any medical questions, always ask your physician. I'm just a lupus patient who's seen a lot of doctors. Your microphones are going to be muted during the webinar. Afterwards, we'll be able to do questions and answers that'll be unmuted, and I'll answer any questions you might have. Ask anything. And if you're not watching this live, you can go to Breitbart.com, go to the lupus community, and tape yourself asking any question you might have, and either I'll answer it or someone else will tape an answer back for you. So thank you so much for coming, and I guess we'll get started. Okay. Lupus fog. Now everybody pretty much has their own idea what lupus fog is. Everybody knows what lupus fog is. Forgetting things, being confused, where did I put this, where did I put that? Mood disorders are part of lupus fog, cognitive complaints, anxiety, headaches, mild memory loss. And the difference between lupus fog and, let's say, Alzheimer's is that in Alzheimer's, you forget things for good. With lupus fog, it's only temporary. One of the most interesting questions about lupus fog that people ask me is, what causes it? That's a very good question. We know that it's related to your central nervous system. We know lupus is the disease of inflammation, but we don't know what causes it. Doctors aren't sure what causes it, so there is no answer to that. We don't have the direct answers on what exactly is going on in your system or your brain that would be causing lupus. So it's kind of like this. And I want to tell you a story which might explain what lupus fog is very well. And that's not remembering things from 1 minute to the next. We all know that. But one of the real signs is I had one day when I was first diagnosed with lupus, and it was before my medication started kicking in. As you know, you're on Plaquenil, and Plaquenil can take 3 or 4 months. Other medications, they don't work immediately. So you're still pretty much at the beginning suffering, from your symptoms. And some of them can be pretty bad. Well, with my lupus fog, I was still working at the time. And I remember coming home from work, and my husband used to always meet me at the bus stop. Well, I went to the bus stop. I got off the bus. My husband was there to meet me with our dog. And I had this feeling looking down the street of not really recognizing it. I knew I was there. I knew I was in the right place. I knew I lived, maybe 200 feet away from there. But it felt new. And that is the kind of lupus fog that some of us get. It's a little more than forgetfulness, more than where did I put my keys, more than, why can't I remember what time my doctor appointment is. So, but there are things that you can do for that, and I'll mention that now. I went to a couple of these memory sites that are free online, and you can go there and you can play some of these memory games where it's kind of fun, and it's like when you play the game of concentration, where was the piece, matching up the pieces, remembering where it was. And then they have like I don't know if you ever played Simon, where you would remember the musical notes. You do things like that. You do exercises like that, and they really do help. And the other thing is as simple as pen and paper. I write everything down. I either type it in my phone, I write it down. You just don't trust your memory to anything. So that's, I would say, lupus fog. But we'll go on to the next slide where we'll talk about, can you turn the slide? Okay, hang on. Here we go. Do we have the next slide? Oh, we do. Okay. Okay. Sorry about that. Okay, now we're talking about some of the symptoms. Now, in central nervous system lupus, we call it NPSLE, which stands for neuropsychiatric systemic lupus erythematosus. Sorry, it's a tongue twister, but that's what it's called. Now, normally, if you're diagnosed with NPSLE, you've got more than lupus fog. You have more going on behind the scenes there. There are questions. Now, it took me a long time, but I did some research. I found the questions that a psychiatrist will ask you. There's a 45 question criteria. So they are, do you have difficulty in reading and retaining what you read? Now, I think that's pretty basic. We all do. Do you ever see people or animals that are not there or hear voices? So you can see that we're moving from lupus fog into some real issues here. Have you become aggressive, exploding easily? Now, I know that some of the questions that they ask, or that you will be asked if you go to see a neuropsychiatrist or you're referred to one, some of them are related to anxiety, some of them are related to depression, some of them are strictly related to neuropsychiatric lupus. Have you been speaking or laughing alone? Have you noticed that people wish you bad luck? Have you had moments where you feel happy for no reason? Have you been moving, singing, or talking nonstop? Have you been able to speak? Have you not been able to speak or recognize people? This is the next slide. Have you heard or seen things other people don't see? Now, there's a lot of questions up there, so I'm just going to read some of them to you. Have you ever been told that you say things that don't make sense? So you can see that with some of the questions, you may not be aware that you're doing these things. So it's important for them to ask. Another question is, have you ever presented with seizures? The kind that, you may fall to the floor, the kind that come with muscle spasms. Now, that's real central nervous system lupus. Those are some of the things that inflammation can cause. Have you suffered from bouts of madness? Have you ever felt that you can't attend school? These are all the kind of questions that you'll be asked that will help a doctor diagnose you. Those are the clinical questions. Now, there are also tests that can be done, and we'll go to the next slide. Movement disorders. Movement disorders are seizures, strokes, muscle spasms, tics, similar to people with MS get jerky movements. Now, I know that I have myoclonic seizures, and the best way to describe those is, how when you're falling asleep and you kind of hit your head and wake up? That's what they're like. They happen before you fall asleep, when you're extra tired, and it's just a twitch. That may not, it isn't anything health threatening, but it is something that can happen. Mine, in particular, was diagnosed by a neurologist who did an EEG and found seizures and slowing in the left side of your brain and that kind of thing. And some people with lupus may have more, some people less. We're also talking about restless leg. I know a lot of us get restless leg, and that's all part of muscle and movement disorders. So that's something that you want to think about as far as having neuropsychiatric systemic lupus, because it's all part of the central nervous system. So, but if you're having these things, don't panic. It doesn't mean that you have what's called lupus cerebritis or vasculitis. It's important to make that distinction, because just like lupus symptoms vary from person to person, and just like the severity of those symptoms vary, the severity of your central nervous system symptoms varies. So it isn't, it's not a death sentence, and it doesn't mean that anything's going to happen. So those are just things that are part of having central nervous system lupus. So I'm going to go to the next slide. And part of central nervous system lupus, doctors divide it in two ways. One way, they talk about the central nervous system, and then they separate it when they talk about the peripheral nervous system. So I know a lot of us know a lot about neuropathies, about peripheral neuropathies. Some of us have cranial neuropathies. People with Sjogren's, our studies show that they have a 28% chance of having cranial neuropathies, and those are brainstem nerves that are involved. And some of the conditions with those are trigeminal neuralgia. I don't know if you have that, but many of us do. They are oops, sorry. Okay. Trigeminal neuralgia is a neuropathy that affects the nerves and muscles of the face. It's one of the most extremely painful conditions actually known to man. Optic nerve conditions, facial nerve palsies, those are part of the peripheral system. Those can be caused by peripheral system lupus, which is a branch of CNS lupus. Other peripheral neuropathies, tingling in your hands and feet. We know we get Raynaud's in our hands and feet, where your fingers, tips of your fingers turn blue and the blood vessels are constricted. There are small fiber neuropathies, which are similar to diabetic neuropathies. Same thing, tingling in your extremities. It can be freezing kind of pain. It can be hot kind of pain. It can be sharp. The nerves that produce pain can be any kind. Mono or polyneuropathies, other neuropathies that are part of the peripheral system and can be caused by lupus. There are autoimmune neuropathies. There's a whole section on that stuff. There's the kind of demyelinating polyneuropathies, and those are like the same kind that people with MS get, where the myelin sheath on the nerves are damaged and you lose feeling. You see people with MS and they've lost feeling in their legs and stuff like that. That can happen with lupus also. Myasthenia gravis, now also called MG, is like a slowing in your muscles. So the message that goes from your brain to your muscles slows down, doesn't reach it in time, and you have slowing there. And for some reason, which I found interesting, olfactory impairments. Your olfactory nerves are part of your cranial nerves, and they're your sense of smell and the ones in your nose. So, for example, I have multiple cranial neuropathies, and I always know when they act up because I smell different smells that get stuck. I smell paint. I smell, I smell like a burnt copper. Also, burning mouth syndrome. And I want to mention that here because part of the peripheral system are those nerves. And I had burning mouth syndrome for 3 months. And my doctors were shaking their heads. What, how can this happen? But that's part of it. That's part of the neuropathies that can be caused by lupus. So really interesting. Autonomic disorders are part of the peripheral system. These are things like POTS, orthostatic hypotension, where if you're laying down, they do a test on you and then you get up real fast. That can affect your heart rate, and they can test you for that. The autonomic also controls your temperature. So there are other things that can happen, all part of those peripheral nerves, which are affected when lupus affects the nervous system. So I want to go on from there and talk about some serious, very serious central nervous systems. Now I'm going to talk about the ones that we are all afraid of, the severe ones, the kinds where you have inflammation in your head, now in your brain. Now this can be, it can show itself on the next slide, a rapid onset of headaches. And these aren't just your normal headaches. These are, oh my God, my head is going to explode headaches. Hypertension, seizures, strokes, or TIAs, ischemic strokes, which are what's called mini strokes, which some people with lupus do get. So there are a good percentage of people with central nervous system lupus who have had a stroke. So it's partially due to inflammation, partially due to blood clotting issues, and how the autoantibodies affect it. So you wanna know about that. Altered mental states, as you know, serious dementia and that we talked about, and these are the ones that we're going to talk about now, the vasculitis and what they used to call lupus cerebritis that can cause coma and death, and what those look like. Yeah. On the next slide, we talk about inflammation of the blood vessels in your brain. Now, there's a picture up there of a brain with lupus cerebritis, with vasculitis. And by the way, I just want to mention that actual vasculitis is extremely rare with lupus. So it can happen, but it's rare. You're not going to go right from lupus fog to cerebritis. It's still less than, I think it's like less than 5%. So you should know about it, absolutely, but don't lose sleep. With vasculitis comes high fevers. These are the seizures, the strokes, the psychosis, the coma, and what can lead to death. The way that they determine it is, I'll go on to talk about that. Let me go to the next slide. Okay, now you saw that MRI. An MRI will look for white matter, nerves or lesions in your brain and spinal cord. And this is it's the same way that they look for MS to see if there are lesions there. So in that last picture, you saw that one of those was lit up like a Christmas tree. That was the one that had white matter in it. As far as to see if you're having any seizure activity, a neurologist will give you an EEG. So if you're seeing a rheumatologist, everybody with lupus knows that you probably have a half a dozen specialists that you go to because it's systemic. So a neurologist is the one who will do an EEG to test your brain waves for seizure activity. Another thing that they'll check for to see what kind of activity is going on are the autoantibodies that lupus causes that do the attacking. And there is one called an anti-ribosomal P protein. And they will look for that to see how abundant it is in your blood. And if you have a lot of it, that's a pretty good assessment that you're having trouble. A skin biopsy to check for neuropathy, that's another test that you can have. And I'm going to go on to, there we go, the treatment. Treatment for NPSLE or neuropsychiatric systemic lupus. The treatment, as you probably are well aware, there's no cure. Steroids, there are, you'll probably be hospitalized if you have the serious kind, like vasculitis. And in that case, they will be giving you pulse steroids like Cytoxin, cyclophosphamide, and other steroids like prednisone, methylprednisone. And 95% of the time that these are administered, they work. So even if you do find yourself in a situation where you've got serious involvement with central nervous system, and you do and if you do have white matter in the brain, these medicines in most cases will bring it down. They won't stop it from happening again, but they will help. So at least you know that there's something you can do. As if you're having seizures, you know, that will be treated separately. There's medicines like Tegretol and Dilantin that will help with seizures. So you can have less of them. And the most important treatment, my doctors have told me, for lupus is stronger medications to treat the underlying disease. Since it's lupus that's causing all this, you know, every so often you need to check the medicines you're on, the doses you're on, and sometimes you need stronger or different medications that will help. There are patients that I know, people that have changed their medications every year, every 6 months. So, you know, there's choices here. There's Benlysta, the biological. There's methotrexate, Imuron, Cellcept, and combinations of these. You know, Plaquenil, the gold standard. So, ask your doctor if you feel like you're being undertreated. Say something. If you're overtreated, if you feel that way, say something. Because the most important thing for you and your doctor is to make sure that you're on the same page. You're taking the medicines that they give you. So I think we're getting close to question and answer. And I'm happy to take any questions that you have. None is stupid. Just ask.
Julie, I have a question.
Okay.
How long have you been diagnosed with lupus, and how were you diagnosed?
I was diagnosed in 2010. I'm 55, and I was diagnosed by a dermatologist. I had been having rashes and fevers and issues with my kidneys, and none of my doctors had any idea what it was. I had an ANA that came out normal, and I was borderline rheumatoid arthritis, borderline RA, and my rheumatologist didn't even think to test me for lupus. Went to a dermatologist who told me, come back when you got a really bad rash. So I did. I went back. He did a punch biopsy of my rashes, and he did a direct panel ANA to check for the autoantibodies. And boom, he says, you don't just have lupus, your body is screaming lupus. So that was how I was diagnosed. But it can be years and years for some people, absolutely. And the other thing is there's no test that will 100% say that you have lupus or 100% say that you don't. as most of you know. There are the 11 clinical symptoms that the ACR has come up with. If you have 4 out of the 11, they say you probably have it. So that's how I was diagnosed anyway.
Okay, so certain symptoms of lupus is probably related to certain symptoms of other illnesses also, would you say?
Well, because lupus is systemic, it can affect, the inflammation can affect any part of your body. You can have other conditions in addition to lupus as well. So lupus could have caused your kidney issues, your nephritis. Lupus could have caused your peripheral neuropathy. Lupus could have caused, like I get uveitis, inflammation in your eyes. And then you could have some of these, you could have a thyroid disorder. Autoimmune diseases like lupus like to hang around with other autoimmune diseases like mixed connective tissue disease, Sjogren's, scleroderma. So you could very well could have more than one. So yes to your question, lupus can cause these issues, conditions, and you can have these conditions in addition to.
Thank you.
Yeah, sure.
Julie, what question can you ask your doctor, or what can you ask your doctor to send you for a lupus test?
Okay, what you want to do is you want to ask your doctor for what's called an ANA titer, TITER, or a direct ANA test. You want them to test the proteins in your blood, the autoantibodies, for markers that show that you have these proteins, and they will point towards an autoimmune disease that you might have, depending on which ones you have. And it's a pretty good indication. Having those alone doesn't mean you have lupus, but it's a pretty good indication, especially if it's in conjunction with joint pain, muscle pain, fatigue, any kind of other blood clotting disorders. Those are popular with lupus, nephritis, any kind of kidney problems, anemia. So yeah, you want, and if it runs in your family, because they don't know what causes lupus, they say is partly genetic and partly environmental. So if someone in your family has lupus, you know, you want your doctor to be aware of that, because it brings up the percentages of you having an autoimmune disease if you have some of these symptoms. So you want to ask for the test. You just want to be very specific. Could I have lupus? And ask for the test.
Okay, thank you.
Sure.
Julie, I have a question.
Okay.
Is lupus typically an adult disease, or do children get that too?
Lupus doesn't discriminate. There is neonatal lupus. Sometimes babies have right after they're born, but you know, lupus can happen anytime. I mean, usually pre-puberty girls, they seem to notice it the most then, and then women in their late 40s, early 50s. I don't know why that happens, but that just seems, as far as the people I know, when they usually get diagnosed. Men too, of course, men too. But that doesn't discriminate. It can happen anytime, any age.
Thank you.
Sure.
Julie,
Yeah.
In a case with lupus, you said that there's no cure. Is that correct?
That's correct. There is no cure for lupus. There's only been one medication for lupus, one new medication in the last 50 years. And that's a biological, that's Benlysta. The rest of the medications for lupus have been around a while, and they weren't intended for lupus, but they work on lupus. Like Plaquenil is an anti-malarial. They don't know why it works, It's the gold standard. And then there are DMARDs, which are disease-modifying medications that a lot of us are on. Medicines like Cellcet, methotrexate, Imuron, and there's medicine and steroids, of course. Steroids that can stop an overactive or slow down an overactive immune system from attacking your own body. But there's no cure, and we need one.
Okay, so since you said that there's no cure, at any time then would you find, because of taking the medication and stuff like that, can you go into remission or no? There's no remission.
That's a really good question. I'm a patient, not a doctor, but I will tell you that I hear people say that, and I personally don't think that there's really a remission because it can attack you anytime, anywhere, of any severity. You can go through long periods, years and years, without having any severe symptoms, or maybe even any mild symptoms, because lupus is all over the, graph there of what can be happening to you, how it can be in your own body. But remission, it's hard to say. I would just say if you're not having any symptoms, enjoy it. But as long as there's no cure, I wouldn't say you don't have it anymore, if that makes sense.
Okay, so then it would lay dormant and then flare up at any point in time without you even knowing.
Right. And yeah, it could. And there are triggers. Some of us have triggers. For me, I'm very photosensitive, and I know if I go out there in that sun, like where I live in Arizona, that UV out here is in the severe range, and I know I'll break out in a rash. I know I'll get uveitis in my eyes. I do 99.9% of the time if I'm exposed too long out there. And it can precipitate a flare-up. It usually does. Sometimes you don't know what your triggers are. Sometimes there might even not be a trigger. So I would have to say, unfortunately, yes. Anything can happen with lupus anytime, just as as inflammation can damage any part of your body anytime. So yeah, it doesn't, as far as it lying dormant, I'm not a doctor. I would say, yeah, it's there. It's always going to be there until they have a cure. That's my opinion.
I have a question. You were saying that lupus has the ability to cause psychiatric issues, psychiatric problems. Is this, your doctor, you said, failed to even suggest that lupus might have been an issue. So is it fair to say that if doctors even know that lupus exists, that they're not going to make a connection between the lupus and the psychiatric issues?
That is a super good question. And I'm going to answer it as honestly as I can here. No, most doctors won't make a connection unless you're absolutely suffering from psychosis and from hallucinations. It's your doctor may not go there. You have to specifically ask your doctor if you can get a referral to a neuropsychiatric doctor to have a test done. Those questions that I asked you are the kind of questions that you'll be asked in a neuropsychiatric test. And my experience with rheumatologists and neurologists are that they're not going to go there unless you're really, really out there having some serious anxiety or dementia. They're not going to discuss it.
Okay, thank you.
Okay.
So, hello?
Hi. I'm here.
Yes, the doctor that you would go to, is there, if you went to just like a regular primary care doctor, would they be able to do any type of diagnosis, or do you have to go to a specialist, like you said, because you said there's so many doctors because there's so many different,
Right.
types of lupus that, so where would be, if I'm feeling like not well or whatever it is, would going to my primary care doctor be the first step to take, or a specialist?
Yeah, it would be the first step. I mean, I don't know how your health insurance works, but mostly I've always had to have a referral to see a specialist. And the first doctor I see is usually my general practitioner. They can test you. There's nothing stopping them from ordering an ANA test for you to see if you have the antibodies. If you're having rashes, you should see a dermatologist. If you can go straight to a specialist, I would suggest making an appointment with a rheumatologist. They're the ones that treat lupus and can also do, the ANA testing for you. And they know a lot more about lupus, where they'll know if the symptoms that you're having are conducive of lupus.
Okay, thank you.
Sure.
What is an ANA test?
It's an antibody test that checks for the proteins in your blood. There are two kinds. One is a titer, and what they do, I'm probably saying that wrong, but what they do is they test your blood for the proteins, and then they dilute it until they can count what's left, and they examine those, and they can tell you what kind of proteins are in there if you've got the antibodies. And the other one is a direct panel, ANA. And that one is newer, and it will test for several autoimmune issues for the antibodies, the autoantibodies. It will look for different proteins. And those different proteins point towards different autoimmune diseases. Many of them overlap. For me, when they did my test, I had some of all of them, but I had most of them is what's called double-stranded DNA. And that's what your rheumatologist and your doctors will use, in addition, with your other symptoms to diagnose you and tell you what your disease is, what condition it's pointing at. And they don't always work. I also suggest you have it done. If it comes out negative the first time, have it done again in 6 months. Don't take no for an answer, because sometimes the proteins they don't show up. I've had that happen too, and there are people with lupus. I had a really smart rheumatologist tell me once that you cannot relate lupus activity to the antibodies that are found in your blood, that they don't always go hand in hand. So you might not have any show up at the time that you have your test done, but you might be, laying in a hospital bed with nephritis and covered from head to toe in a rash. So if it comes out negative, have it done again. If you think that's what you have, don't give up.
Julie, when you have a flare-up, what is your normal day like?
Well, mine in specific with a flare-up is I get a rash. I get hives that itch, and a rash, like mostly on my arms and neck. You can see that my skin's permanently like scarred from it. For me, my eyes, I get recurring uveitis, and that means that it's terrible that it makes it hard to see sometimes when it's really bad, and I have to use steroid eye drops. I also have inflammation during my flares that I get in my feet. I don't know if anybody else does, but I have plantar fasciitis, and that's from lupus too, and it makes it difficult to walk. There are things you can do for stuff like that, just like you would treat it if you just had it without lupus. I get cortisone shots in my feet. and I have other procedures that help with stuff. But for me, that's mainly lately what my flares consist of. They used to be a lot worse. When I was first diagnosed, I was in stage 3B, chronic kidney disease from nephritis, and I was lucky they caught it. I was just lucky that I was one of the people that bounced back. My kidneys bounced back, so I haven't had trouble with them since. Knock on wood. But
So it can be very painful.
Oh yeah, it can be very. Oh yeah, it can be painful, just like any kind of inflammation in the body will be painful. You know, neuropathy can be very painful. Even inflammation in your, like gastritis and in your stomach and your tubes, your neck can be painful. There are other conditions that lupus can cause that's painful, like there's costochondritis, inflammation in your rib cage, inflammation in the lining of your heart. So there's no organ that's immune to anything that lupus wants to cause.
We have time for one more.
Okay. Hi. How cute. Aw.
All right, if there are no more questions, we could wrap it up.
I think she was just about to ask one,
Oh,
and that's Diane. Did you have a question, Diane? No. Well, I just want to say real quick, a flare. You asked me about a flare, and a flare is considered any time that the symptoms that you usually get are worse, or any new symptoms that you have. That would be a flare. That's when you go see your doctor. I want to thank everybody for coming. I really appreciate it. And next week, I'm thinking that maybe we'll talk about lupus in the skin and rashes and the different kinds that it causes. So I hope you'll be there.